Obviously, what we do know now is there are longer-term impacts, and you mentioned something along the lines of rehabilitation that can be done. Can you elaborate a little bit more? What can we do to minimize long-term impact of COVID?
So basically, one is obviously the moment you get affected or you have tested for COVID, that's actually the time when you need to start onto the rehab program as well. Now, whether you are in a home quarantine or whether you are in a hospital because of the severity of the illness, the rehab should start immediately. So, what do you actually mean by rehabilitation? Basically, rehabilitation is a branch of medicine which involves basically restoring your health back to a normalcy and how we can improve your physical condition by three aspects. One is by training your body, by giving you certain therapeutic measures, and all this to happen under strict supervision. When these three things are happening together, obviously your recovery becomes much more better. The person will confidently now know what he's supposed to do, how much he's supposed to do, and how he's supposed to progress, as opposed to you end up doing things by yourself where you really don't know what is happening inside and eventually can lead to a big disaster. So rehabilitation has its importance right from day one, the moment you are getting infected, until you are completely recovered and back to a normal life. Okay.
Sure.
So as we say, this can act at different stages. Okay. And which I just mentioned, it can be right from day one, which we call it as the acute phase, or you are recovering, or even after coming back home and after testing negative. It ideally should continue for some time till the rehab specialist feels that you have now completely recovered and you can get back to your normal life.
Great. And of course, as we know that the rehabilitation protocol, ideally speaking, can start even if you're not infected.
Exactly. So basically, it can have its own preventive effect as well. So
Yes.
people who have not tested positive also, although we use the word rehabilitation, but rehabilitation can also be preventive measures. Okay, rehab did not always mean only after getting affected by some chronic disease. It can also play its role in a prevention of a disease. So the more you can improve yourself, both physically and mentally, under some supervision by taking the rehab specialist help to get your risk factors under control, you are preventing yourself from suffering from any chronic disease in the long term. Okay, so it is definitely going to be helpful both in terms of prevention as well as recovery and getting back to a normal life.
And more specifically for COVID, I know rehabilitation is relevant for all chronic diseases, but specifically for COVID, who needs it? How long do they need it for? Who should be delivering it?
So who should be delivering it? For sure, it has to be delivered by people who are specialists in the field. So we call them as rehab specialists. In simple terms, people would also relate rehab specialists to physiotherapists. But when we are dealing with a certain illness, we need that specialist to be having good enough knowledge with regards to that illness as well. So we have rehab specialists who can be a combination of a physician as well as someone who has specialized in rehabilitation of chronic diseases. All right. So we as a FirstDr team, we run cardiac rehab program, cancer rehab program. Now we have started with this COVID-19 rehab program, whereby we specialize in all these specific chronic diseases. So that all the care that you are getting for that particular illness, you are getting it under one single roof. Okay, whether it is regarding your medications or it is regarding any specific complication that's happening and recovering from that particular complication, unless that specialist has a comprehensive knowledge about that particular disease, you won't get a complete care. And that's what is the role of a rehab specialist, that because of his expertise and because of his all-round knowledge in that field, he can definitely help you to recover much more faster. So in terms of the plan, okay, in terms of the rehab benefits that we are talking about, why it is required? Because when you are suffering from COVID-19, now to specifically talk about COVID-19, as a delayed effect or even as a chronic long-term effect of that COVID-19, people can have an impaired lung function, people can develop muscle weaknesses, joint stiffness. There's something called as a post-viral fatigue syndrome, okay, which basically means because of that illness, they develop this chronic fatigue syndrome. Okay, they might be absolutely fine, no symptoms, but they still feel very tired throughout the day. And I have been rehabilitating a couple of patients recently who have got infected almost 3 months back, and they are still not up to the mark. They are still struggling to walk, without support. They are struggling to maintain their balance. So this fatigue can really last for a very, very long time. And that can be because of various factors. It can be the effect of the illness, because of the immobilization due to the illness. So eventually you need that proper guidance and supervision to get back, and that's where rehab would be very specific for the COVID illness. Because as we said, eventually all your organs are getting affected. So you would never realize which part is getting affected. And because we will be constantly monitoring your progress, we will know how your parameters are staying and accordingly help you.